Thank you for watching, everyone. My name is Dr. John Stewart, and I've been working in electrotherapy for many decades. I was in charge of electrotherapy evaluation for Health Canada for 10 years. So I have a lot of experience in any kind of electrotherapy, not just treatment of any one organ, but I'm interested in electrical stimulation, magnetic, and light, biophotonic. So we're going to cover a lot of these topics today. Primarily, there's a need for treatment of brain disorders. And for that, we have transcranial magnetic stimulation. And we have a website called Transcranial Institute, and that's available on the internet. Now we have a new clinic and a new website that will include all the electrotherapy modalities because they're all very important. And we're going to look at things like low-powered PEMF, which is pulsed electromagnetic field, which I'm going to demonstrate here. Then we have medium power and high power. It turns out that the brain will not respond to the low power. You need the very high power of 2 to 3 Tesla of magnetic pulses. 1 Tesla equals 10,000 Gauss. So it's a lot of energy. So I want to demonstrate each of these to you today. And we have today with us Ashley and Gadi, who are also going to comment and join the conversation. So welcome, Gadi, and welcome, Ashley.
Hi, hello.
Hello, thank you.
So first of all, I want to talk about my early invention, the portable TMS unit for depression. Portable meaning that it can be carried by a nurse for home treatments, or someone can use it at home. In this case, it can be carried by a nurse who can deliver and give a half-hour treatment. And the treatment comes out through this coil. Let me turn it on. So it's now working at like 1 per second. And to show you the power, I don't know if you can see the jumping of this paper. This envelope is holding some neodymium magnets that are being pulled by this 2 Tesla pulses. Bam, 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 bam. And I can vary the frequency jumping. I go from less than 1 pulse per second up to 100, which is a very high rate, exceptionally so in our industry. So that's the portable unit. Now, next to it is the higher power professional unit for psychiatrists, either in private practice or in a hospital clinic. And this is a 3 Tesla unit. So this is 2 Tesla and this is 3 Tesla because it's more powerful, more professional, and will go deeper. And again, it has the same parameters, except it has a counter, frequency counter, because a psychiatrist wants to know what frequency he's using for what part of the brain, including the cerebellum that we're now stimulating. Normally, we stimulate up on the dominant hemisphere, which is up here, and that has a dumbing down effect on the negative thoughts that cause depression. it turns out that TMS, or transcranial magnetic stimulation, is now being used for a very wide range of clinical conditions, not just depression, but autism. And even for healthy people, it can induce a savant state. It can be treated for cognitive impairment, dementia, and similar kinds of conditions, stroke, post-stroke, brain disorders, and deep brain stimulation. Now, this coil is a single core coil, many turns, but there also is a butterfly coil that some companies, some of our competitors prefer. Now, this one only gives us superficial treatment. It won't go down more than about 1 inch, whereas the single coil here can go down about even 3 or 4 inches, very deep. Let's see if I can demonstrate that. So this is a magnetic field detector which I invented, and it's picking up the pulses. See how far it goes. It's a very powerful device, even though it's only 2 Tesla, the portable unit. So it's eminently suitable for home use. And then if I turn the frequency up or down, so I go down to say 1 per second and go up, and you can hear the sound up to about 100 per second. Now, this portable unit does not have an advanced feature called theta burst. Theta burst is a new popular modification that is in the professional model. And the professional model has a frequency counter and an event counter. So if you're giving, you can give 2,000 pulses. That's called a dose. So you want to know in your records how many pulses you gave to the patient and at what frequency. So that this is displayed with this meter here. There are other coils that we might use to put over a part of the brain, and there's a certain advantage in having this flexibility. It can be put around, and the patient can be lying down on a couch, moving their head around, getting every part of the brain stimulated. And we have this giant, I can hardly carry it. It's a giant coil. You can put not only over the head, but in fact, magnetic fields can treat neuromuscular disorders. It can reboot parts of the nervous system. And I've had patients who had a desperate condition called ileus. That people can die. It's a paralysis of the gut, like the colon and the cecum, and the gut can become gangrenous. This is all on Wikipedia. So if any of you know of anyone with a gut paralysis, if it lingers, you can get gangrene and death. You can die from this. So I've had patients whose gut responded to the TMS coil over the colon and the cecum, and it's kind of rebooted the nerve complexes, the gut brain, in other words, because there's a solar plexus of nerves, and you can actually, when we put this on, you can actually feel the gut responding. and it can bring back to life quiescent or dormant gut and can save lives. So this is a worthwhile thing to be aware of. And there are other coils, smaller coils, like for the shoulder and for the hip, our knee, ankle. But then we don't need 2 Tesla or 3 Tesla for these joint conditions. This is a PEMF generator that this is a 2-channel version. Will put out a low power like 0.1 Tesla and has a frequency counter. Let's see. See if we can activate this one. Okay, yeah, this is a nice little unit for low power pulse magnetic field treatment for joints, shoulder, headache, migraine, and it has the advantage of a frequency meter. I can adjust the frequency. It's running now about 18, 17 pulses per second. I can turn it down there, 3.3 with great digital accuracy. And professionals want that now. They want to know exactly what frequency they're using, because the frequencies do have different benefits. If you're below 10 pulses per second, you might get a totally different response from above that. And there's literature now showing that there are bands of good and bad frequencies. So you've got to be careful. You want to have the right little range of frequencies. So this is why the frequency meter is so important. And let's see, it goes up to over 40 pulses per second, which is in a gamma range of the brain waves. So this is a 2-channel model. So you can teach 2 locations simultaneously. Now with this unit, this is a 6-channel PEMF generator, again with the frequency control. And each site, each of the 6 can be controlled with a different frequency. So you could be treating, you got the patient in there for an hour and they have shoulder pain, they have a headache, they have knee problems, they have ankle problems. You want to be able to treat 6 locations simultaneously rather than having them come back 6 times. So that's why I invented this this unit. What else is there? Okay, yeah. Now, in addition to magnetic stimulation, there's also electrical stimulation of every organ. All organs will respond to electromagnetic energy, including light. There are a lot of electrical treatments, like interferential treatment, where you have 2 different frequencies interacting together, giving rise to a third one that is more biologically therapeutic, and that's interferential. Or you have just simple TENS, TNS or TENS, transcutaneous electrical nerve stimulation, like Dr. Ho has. And then there's transcranial electrical stimulation. Transcranial electrical stimulation uses little electrodes all over the scalp, like maybe 50 or 100 little electrodes. I have a Tesla coil device that does this on the entire skull simultaneously, using high voltage Tesla pulses. So Gadi and Ashley, do you have any questions or thoughts at this point?
This device that you just described, can you demonstrate it, or shall we do it in a separate video?
Which device is that?
The electrical stimulation.
That one. Yeah, it's a big unit. It's not convenient to bring it into this room. We should do it as a separate.
Okay.
A separate unit. Yeah.
Okay. The other thing is, you've described two devices here that kind of represent a similar, or the two extremes of the same EMF technology.
That's right.
What is the main difference in application between the TMS and the PEMF devices?
Well, the PEMF is much lower powered, and it uses smaller coils. The coils here don't get hot, unlike TMS. We're putting hundreds of amperes through coil, and we're getting like 30,000 Gauss with this big professional unit. So the coil gets hot, and after half an hour, you have to stop and plug in another coil. So you've got to have two coils, one sitting cold, waiting. So if you're running a clinic and you have patient after patient after patient, you want to be able to get the cold coil and replace it and plug it in. So it's quite versatile and allows that flexibility. Some of the major competitors use liquid to cool the coil, but then that adds tens of thousands of dollars to the price.
Right.
We're trying to keep this reasonably affordable.
Right. But what about the range of diseases or conditions? What you know, in simple terms, when do we use TMS and when do we use PEMF?
Well, the PEMF is a low power one. It generally is for relatively minor ailments like arthritis, migraine, although that's not minor, but these can respond to the lower power. And there are some experts who tell us that low power is better, less is more, which, you know, from homeopathy is a reasonable hypothesis. Yeah, less is more. Now, there's a very good description. This is from Wikipedia. It's pretty thorough, and I recommend anyone interested to read Wikipedia on transcranial magnetic stimulation and on PEMF. Fibromyalgia is the most common indication for PEMF, and that's probably the answer to your question. Aches that people have on their shoulder, or a headache in nerves and muscles. Yeah. And as I mentioned earlier, the paralytic ileus, which is an unusual use of that high power 2 or 3 Tesla. It takes that much energy to reboot the bowel. Well, only in the last decade or so, I invented probably the world's first TMS unit back in 1982, when I had a holistic clinic. I built a powerful version of this back in 1982, mostly for musculoskeletal disorders. I was treating a lot of athletes, at that time who were getting myositis, inflammation of the muscle. And one thing we know about magnetic fields, it has an anti-inflammatory effect. So these inflamed muscles would only respond when we took the energy away up to 2 and 3 Tesla. But at that time in 1982, it didn't occur to me that we could treat the brain. The practitioner could start off with a medium or low power PEMF, such as this one, because that's a nice little 2-channel unit with frequency control. Start with that. It's moderately powered, but if you have more challenging conditions, you might want to go to the portable unit, particularly if you're trying to treat autism, migraine, dementia, then you do need the higher power. Yes, because if someone has arthritis in the ankle, we could treat their brain at the same time.
Okay.
With more, what the TMS up here and the PEMF down at more peripherally. There are no side effects to either of these technologies. That's the beauty. It's non-invasive, and it won't even cause a headache. So it's a no-brainer. The benefits to PEMF. Well, yeah, alleviate, it's anti-inflammatory. And why does inflammation happen? I have a theory about viruses. I think they do a lot more damage than we realize, and they leave inflammation in all organs, the brain, the heart. We get myocarditis in muscles. So viruses are our worst enemy, and they can often be very subtle and ingenious. And target unique. And that's why I think the paralytic ileus, how come the gut gets paralyzed? I suspect it's because of some unique virus that is programmed to attack that particular organ.
Okay.
And we know, and look in the stomach, we know there's a bacterium that targets the stomach and causes gastritis and ulcer. It's called Helicobacter pylori, H. pylori. So when people who have stomach ache or gastritis, it probably is this H. pylori bacterium, for which we take colloidal silver as a treatment. Yeah. It's cost effective if you're suffering from depression that has not responded to amitriptyline and other antidepressants. I've had a few depressed patients who've had one treatment, like one particular patient. The next morning he woke up and for the first time in 14 years was not depressed. So this can be dramatically effective, and this was using the high power 4 Tesla machine, and it goes deep into the brain, so you get deep brain stimulation, and in areas that are normally not available except through this. So for that person, and I have several customers who bought it for their own personal use. and has paid the money, the $10,000 or so, because it's been worth it for them. Depression is a terrible burden for anyone to carry around. There's no guarantee, and it's not easy to predict. It's kind of a trial and error. Does it work? What I tell people, like before they buy my technology, I actually get an appointment at a local hospital that has TMS. Make sure it's going to work for you, and then consider buying my machine. I don't want to sell a $10,000, $15,000 unit to someone where it doesn't work. And then I have a take back, a refund program. If after 3 months it's not helping, then I'll refund their payment, less monthly rental fee. So they have an opportunity to try it out. Most people do respond. Even normal, healthy people, I've treated myself to advance my cognitive abilities, to make myself into a savant. Well, it has the anti-inflammatory effect. If someone has a pain in the back or the shoulder or joints, PEMF is going to help everybody to some degree. There's a company sells low power PEMF and claiming that it has antidepressant properties, but it doesn't. You need the high power deep brain stimulation for depression. Alleviation of the condition. The pain goes away. The person can sleep at night. They don't have to take analgesics. The migraine gets some relief, and the inflammation subsides, because an inflammation can become infected, and then that's very serious, because an infection can spread and become septicemia, blood poisoning. So, and also some experts tell us that the PEMF magnetic field has antimicrobial benefits. So it's certainly worth trying for everyone. Some people only need maybe 2 or 3, and their body responds. There are good responders to all these holistic remedies, and there are other more resistant responders who need months of treatment. And we don't really know the answers to why people could be so different. Maybe it's something to do with their psychological attitude to their own body, because we know that the mind can heal by itself. So these modalities add to and assist the mind in healing itself. Now, talking about that, you even use coils on the eye, like for macular degeneration. I have a theory that the magnetic and electromagnetic energies can boot stem cells. So, and stem cells can give rise to new cells in the brain and in the nervous system, like the eye. So I have a theory that things like macular degeneration, retinal problems, retinitis, can be helped by magnetic coils on the eye, and also on the gums for gingivitis, or maybe even in the ear for deafness, because the deafness is caused by damage to the hair cells in the cochlea of the ear. And so if those cells can be rebooted, it can help these other conditions. Yeah. ECT is electrical convulsive therapy, and you put the two electrodes across the brain, and then you put about 300 volts. I invented the first brief pulse ECT unit back about 30 years ago. And the old traditional technology just put mains 50 cycle or 60 cycle 300 volts across, which was an immense amount of energy that did a bit of damage on memory at that time. So what I invented was a pulse that had the same therapeutic effect, but very, very little energy. So the patients would not get memory loss. But that was before we heard about TMS. That was before magnetic stimulation of the brain. ECT definitely had and still has benefits. So probably it should not be used when we now have TMS. We have the magnetic pulses that do a similar thing to electric stimulation. TMS, the magnetic, is very safe, totally devoid of any side effects, whereas the electrical treatment is like being struck by lightning. It's going through the brain tissue with an electric current. So it's a lot more, electric treatment is a lot more dubious, let's say. No side effects with TMS. Yeah, because I've treated it myself, as I say, to make myself into a genius. I've found it quite pleasant. It's totally non-invasive. Yeah, as invasive as tickling or a hot shower. Yeah. No, there's no way of knowing. That's why I tell people, go to your local, get a referral to your local hospital, try it out. And if it works, let's move on that. If it doesn't work, then don't spend your money on getting your own TMS unit. The prostatherm. The prostate gland enlarges, and to prevent it from becoming cancerous, we want to shrink it. The prostate responds to all of these energies, to heat, light, and magnetic pulses. So I have a prostate transducer that has all of these energies in one applicator, and that you sit on it, and the energy goes through the clothing, and you get treatment 2 or 3 times a day. So it's another application of magnetic fields that's worth mentioning. Yeah. Ovarian cancer. One very desperate condition that women have, endometriosis, is a terrible condition of the whole abdomen, when tissue from the uterus begins to migrate, and magnetic fields has an anti-inflammatory effect in shrinking the endometrial cultures. So that's a very important application. Perhaps even cystitis, bladder infection, becomes inflamed, would respond to mild and powerful magnetic stimulation. So people could be using it while they're sitting at their office during the day. They could be getting treatment from one of these devices, many hours of treatment. There are high frequency magnetic fields called tumor treating fields, TTF, look it up on Wikipedia and on the internet. There's a lot of literature on it. It's very highly regarded. It will reduce a tumor once you have the right range of frequencies. And that range of frequencies is around 150 kilohertz. And I have one of these that I invented. Yeah, this is my tumor treating fields prototype. It has driven by a 12-volt power supply, and it will plug into any of these coils because these coils are air coils. They will handle 150 kilohertz. There's no iron in them. So, and they just plug in here. So you would treat an area that has a tumor, like a breast cancer, for example. This would be a good application for breast cancer. But do look it up on the internet, tumor treating fields. Okay. You can tune the frequency, and on a bigger model, I'm going to put one of these frequency counters, because I think we need to know what frequencies we're using to quite a high degree of accuracy. The range is 100 kilohertz to 200 kilohertz. And in that range. So we want to be able to start yourself off at 100 and slowly increase up to 200 kilohertz. Or I have a scanning mode that will automatically scan through that range. So I think we've done a pretty thorough job. We've probably come to the end of our discussion. So thank you both for your support and those who have been watching. And look up our website, Transcranial.Institute. And we have a new website coming up shortly that Gadi and Ashley are working on.